You check your blood pressure, your cholesterol, maybe even your A1C. But what if your most important vital sign was your sex drive? Because here's the truth. If you're waking up with fewer morning erections, if you're losing interest in sex, or struggling with performance, it's not just aging. It's a sign that your metabolic system is under stress. So let's talk about it. I'm Dr. Adam, and I work with men every single day, many of whom don't bring up sexual issues until the third or fourth visit. But almost all of them are dealing with it. Erectile dysfunction, low libido, inconsistency with their partner. Today, I want to reframe this as what it really is, a metabolic issue, not a moral failing, not something to ignore, but a vital sign that you need to start tracking. Most guys are told that sexual dysfunction is psychological. So stress, anxiety, pressure, depression, and sometimes that's true. So here's a quick test to see. So if you suddenly lose your libido or suddenly can't perform after a stressful life event, it might be related to anxiety or depression. But in the majority of cases, it's a slow decline. So less morning wood, less interest, more inconsistency. That's not mental. That's metabolic drift. And here's why. Sexual function relies on three things: blood flow, brain chemistry, and hormones. All three are influenced by your metabolic health. Erections are blood flow events. If your arteries can't dilate and stay open, you won't get or stay hard. And here's the catch. The smallest, most sensitive blood vessels in the body are in the eyes and in the penis. So they're the first to go when vascular damage starts. ED often shows up before high blood pressure, before a heart attack, sometimes, as much as 5 years earlier. So if your performance is fading, your blood vessels might be damaged, and you won't fix that with a little blue pill. Libido isn't just about testosterone. It's all about dopamine. So the molecule of motivation and drive. And poor sleep, blood sugar crashes, processed food, low magnesium even, all these things blunt dopamine signaling. Imagine putting watered down fuel in a race car and then expecting it to win, right? That's what happens when your diet and lifestyle short circuit your brain. And the result is low sex drive, low motivation in general, and then ultimately low confidence. This isn't just about the bedroom either. It affects how you show up in every area of your life. And most men think low T equals low sex drive. And yes, testosterone matters, but the relationship is more complex. So here's what's actually happening metabolically. So high insulin levels lower SHBG, and that gives you more free testosterone short term, which sounds great. But long term, total testosterone drops and then symptoms appear. So it's not enough to just chase free testosterone or patch it with TRT. You need to fix the root cause, which is insulin resistance, inflammation, poor recovery. Reclaiming your testosterone starts with building muscle, lowering visceral fat, and then improving your sleep, getting deep quality sleep. Some of you might be thinking, but my doctor said this is just part of getting older. And here's my response. Aging is inevitable, but decline, especially like if you're in your 40s, your 50s, early 60s, that's optional. Declining is optional. We now have data showing that men in their 60s and 70s have excellent metabolic health, are, still having sex. They have great sexual performance, and that's because they train for it. They didn't wake up one day and not have it, and then all of a sudden the next day they're able to perform. It's something that you prepare over the course of years. Another objection I hear is, I had my labs done and everything was quote unquote normal. The reality is that normal doesn't mean optimal. And, normal doesn't mean anything ideal either, because look around, we're not looking to be normal right now. And sexual symptoms are often 10 steps ahead of what labs will show anyway. Your body will tell you what it needs. You just have to listen. In med school, we were taught that vital signs include the obvious stuff: blood pressure, heart rate, respiration rate. But I've added a few of my own. I call them critical numbers. VO2 max for cardio capacity, waist to height ratio for metabolic risk, number of spontaneous erections per week for hormonal neurological health. These are real-time markers that tell me if a man is thriving or sliding. You don't need $1,000 lab panel to know if your health is off track. Just ask, am I waking up with a morning erection? Is my sex drive consistent? Am I ready, not just willing, for intimacy? If the answer is no, it's time to fix the system, not just mask the symptom. So let's be super clear. Sexual performance isn't a bonus. It's not separate from your health. It's one of the clearest indicators of how your body is functioning as a whole. Fix your metabolism and the performance comes back. And when you get this right, you don't just improve sex, you improve your energy, your brain, your muscle, your confidence, ultimately your life. So if that's something that you want more of, subscribe to this channel. I post videos every week that cut through the noise and give men real tools to reclaim their metabolic health. See you in the next one.